I'm one of three public partners in SMC, and I think we had similar experience in terms of the recruitment process. So it was an online recruitment process. It's open to anyone in the public. I responded to an online ad. First stage was really filling in an application form and then answering some questions about some competencies like analysis, judgment, decision making. The second stage was a panel interview, and again there were questions asked on those competencies, and you had the opportunity to talk about your experiences and your skills in that particular area. I was then fortunate enough to be appointed to Healthcare Improvement Scotland as a public partner. I attended a conference for public partners. There was a vacancy at SMC at the time, and I expressed an interest in that. And again, I was fortunate enough to be appointed as a public partner for SMC. I wanted to give something back to the community in Scotland, and at the same time I wanted to learn some new skills, something a bit different to what I'd done before. I wanted to work in a more flexible environment perhaps than I had been involved in before. I think really at the heart of it, I wanted something that was both intellectually and emotionally challenging and satisfying. So the role of our SMC public partner is to ensure there's a public perspective taken into account in decisions around new medicines and in terms of their introduction to the NHS in Scotland. The SMC meet every month. And that's a meeting that's open to the public, and in advance of the meeting there is a lot of evidence that's presented to members of the SMC, so there's a lot of reading to do in advance of the meeting. We want to make sure that we're thoroughly prepared for that meeting. Also in advance of the SMC meeting there's a meeting called PACE meeting, and this is made up of patients and clinicians who are discussing ultra-orphan medicines and end-of-life conditions. So when I was appointed as public partner to SMC, I had a number of meetings with executive members of SMC and Healthcare Improvement Scotland, and included a number of experts in the fields of health economics, some statisticians and pharmacy, because it's really important that as members of SMC we take into account a number of criteria in making those informed decisions around clinical efficacy, cost effectiveness, whilst also taking into account the views and opinions of patients and patient groups. Clearly there's also on-the-job experience, because the more meetings you're involved in with SMC, the more familiar you become with the terminology and the criteria for evaluation, and you become more confident in being challenging of the evidence that's been presented to you. In terms of the challenges that the public partner faces, clearly we're making decisions that affect the lives of patients, carers and families. And we're faced with a lot of evidence that's presented to us. There's no specific formula to decide what's the right or wrong answer, and we make decisions based on all the evidence that's presented to us. In terms of the rewards, clearly we learn new skills, and at the same time we feel as if we're making a meaningful contribution to, in a small way, to society in general, but to the NHS in Scotland in particular.